Hello guys, good evening everybody. In today's lecture we are going to learn about cranial nerves. In today's class let me explain you in detail about each and every cranial nerve, its importance, its clinical significance, and what happens if cranial nerves are dysfunctioned or if they are having any disorder in the body. If any cranial nerve has any dysfunction or any disorder or due to any trauma, clinical manifestations what patient will develop, and along with that we will also try to understand different clinical presentations. Okay, so in today's lecture it is going to become a basic part of cranial nerves anatomy. We will discuss different types of cranial nerves, and along with that we will discuss the physiology and different clinical correlations of cranial nerves. So let's begin our session. So before understanding about cranial nerves, let me tell you, see, actually we have 12 pairs of cranial nerves. See, we already know that we have 12 pairs of cranial nerves, right? So first thing is first, what is cranial nerve? Before understanding about cranial nerves, let me tell you some basic points about nervous system. We all know that nervous system is mainly divided into central nervous system. Okay, we have brain and spinal cord, right? We have brain and spinal cord. This is brain. Brain has right hemisphere and left and right hemisphere. So these brain and spinal cord are considered as central nervous system. Okay, in central nervous system we have brain and spinal cord, and along with this, brain will be ejecting certain fibers which are called nerve fibers. So in that, brain will release some nerve fibers, and these nerve fibers which are coming from the brain through cranium. Let me repeat the point. The nerve fibers or the nerves which are coming out of the brain through cranium are called cranial nerves. Cranial nerves are those nerves which are coming or which are originated from the brain, and some of them are originated from spinal cord also, but majority of cranial nerves are originated from brain, and they are coming out of the brain through cranium. We already studied in previous class that brain is covered by certain specialized bones which are called cranial bones. Okay, each and every cranial bone is attached by a specialized joints, sutures we discussed, right? So cranium, I mean the brain is covered by a very specialized bone or different specialized bones. They are called cranial bones, and the cranial nerves are these cranial nerves are coming out of the brain through these cranial bones. Okay, that's why they are named as cranial nerves. Okay, so in cranial nerves we have 12 pairs of cranial nerves, and we also have different nerves which are coming from spinal cord. They are called spinal nerves. They are called spinal nerves. Okay, so about spinal nerves, already in previous classes I think we have discussed, our student has discussed about all these nerves. In today's class we'll try to learn about cranial nerves in detail, and we have 12 cranial nerves. Okay, so I think you understood. Central nervous system is nothing but brain and spinal cord. And along with this central nervous system, we have fibers which are coming out. They are categorized. These nerves are categorized as peripheral nerves or peripheral nervous system. And in peripheral nervous system, actually these all nerves which are coming out of this brain and spinal cord are again divided into somatic nerves and autonomic nerves. Autonomic nerves. Somatic, we just simply call them as somatic nervous system or somatic nerves, and autonomic nerves. And in again autonomic nerves, we have two main categories. One is adrenergic nerve or sympathetic nerve, and parasympathetic nerve. Anyways, about sympathetic and parasympathetic nerves and all, we will discuss in next classes. Just in this class, I think you understood this basic thing, that mainly nervous system. Let me briefly tell you. Okay, it is very easy to understand, don't confuse here. Nervous system is broadly divided into central nervous system and peripheral nervous system. In central nervous system, just now we have seen brain and spinal cord, and in peripheral nervous system we have somatic and autonomic, and in autonomic we have sympathetic and parasympathetic, right? Simple. So this is the basic classification of nervous system, and now we are discussing about central nervous system. And in central nervous system we have brain. And actually in our class we are discussing about peripheral nervous system. Actually in peripheral nervous system, the nerves which are originating from brain, the nerves which are originated, we are discussing those nerves. Okay, so let's understand in detail about cranial nerves. Before understanding about these cranial nerves, let me tell you some basic terminologies. See, there are certain nerves which are called afferent nerves. Afferent nerves. This is very important. You have to remember. There are certain nerves which are called afferent nerves, and there are certain nerves which are called efferent nerves. Efferent nerves. See, afferent nerves are simply called as sensory nerves. Sensory nerves. Why they are called sensory? No, afferent nerves are originating from tissue. They are originating from tissue, and from tissue they are going to the either brain or spinal cord. Spinal cord. They are called afferent nerves or sensory nerves. They are starting from tissue. They are starting from organs, special organs. For example, we have nose, we have tongue, we have skin, we have eyes. Okay, from all these different organs, the sensory nerves are taking these special senses and they are taking to the brain or spinal cord. That's why they are called sensory nerves. Simple, it is very very simple. Sensory nerves are those nerves which are taking information from the tissues to the brain, and efferent nerves are called motor nerves. These motor nerves, what they do? They do exactly opposite. Motor nerves will send the information from the brain to the organs or to the tissues. I think it is very clear to you. Afferent nerves are called sensory nerves. They are actually starting from the tissue. They are starting from the tissue and they are entering to the brain or spinal cord. Okay, and efferent nerves, which are also called as motor nerves, what they are doing? They are actually starting from the brain and spinal cord, brain or spinal cord, and they are innervating to the tissues. Always remember, sensory nerves are receiving information from the external environment, and motor nerves are sending information to the tissues for response. It is always a reply. Okay, motor nerves are always giving reply, and sensory nerves are always receiving information. This is simply called as input into the brain, and this is output from the brain. Okay, I think this basic terminology you understood. And see, in cranial nerves we have some nerves are categorized under sensory nerves, some nerves are categorized under motor nerves, and some nerves are having both the actions, motor action and sensory action. That's why they are categorized as mixed nerves. Just now I told, sensory nerves are those nerves which are bringing information from the organs to the brain or spinal cord. And motor nerves, what they are doing? Motor nerves are those nerves which are giving reply or which are bringing information from brain or spinal cord to the tissue. Okay, you are trying to play football. Okay, if you are trying to kick the football, your motor nerves are activating. You are eating food, okay, and you are feeling the taste. This taste is nothing but it is the sense. Your tongue is receiving some taste, receptors are receiving your taste, and these taste buds are taking information to brain as sensory or afferent impulses. Okay, I think you understood. And here, just to remember from this, sensory nerves are those nerves which are actually, I told there are 12 pairs of cranial nerves. In that, the first cranial nerve, second, and eighth cranial nerve, these three are sensory nerves. They are especially sensory nerves. Cranial nerve 3, 4, 6, 11, and 12 are motor nerves. And remaining nerves 5, 7, 9, and 10, these are mixed. They are having both sensory action and they are having motor action. I think this point is clear to you all. I just told you the different names of cranial nerves. In that, first cranial nerve, which is called as olfactory nerve, second one is optic, third one is oculomotor nerve, fourth one is trochlear nerve, fifth one is trigeminal nerve, which is very important because this trigeminal nerve is important in it is very important in migraine. In migraine, this trigeminal nerve is important because its anatomy is important in different headaches, which because this dysfunction in this trigeminal nerve will show severe throbbing headache. Okay, and sixth cranial nerve is abducens. Seventh is facial nerve. Again, it is important. And eighth one is vestibulocochlear. Ninth one is glossopharyngeal. And tenth one is vagus nerve, which is another very important nerve. And vagus nerve has certain special characters that all I'll explain. And 11th one is accessory and 12th one is hypoglossal. Okay, so these are different names of cranial nerves, and I have provided some mnemonics for you to understand these cranial nerves, easy to remember them. Okay, so see, just try to remember this mnemonic. Okay, this mnemonic is important. Oh, to touch and feel very green vegetables. So just try to remember this mnemonic. This mnemonic will help you to remember all the cranial nerves in order. Okay. Oh, to touch and feel very green vegetables. So first O represents olfactory, oculomotor, olfactory, optic, oculomotor, trochlear nerve. Okay, and trigeminal, facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, accessory nerve, and hypoglossal nerve. Okay, just try to remember all these 12 cranial nerves by using this mnemonic. Okay, so for this I can't make you easy and rather than this. Okay, from my side I am trying to make you understand. So it is your duty to remember all these 12 names of cranial nerves. Okay, so remember in this manner. If you can remember these mnemonic, so according to that mnemonic in ascending order, you can name them from 1 to 12. Okay, so this is the basic mnemonic you have to remember. And one more thing I told, there are certain nerves which are categorized under motor nerves, and there are certain nerves which are categorized under sensory nerves. And some nerves are having both sensory and motor activity, both sensory and motor activity. Okay, so here just try to remember this another mnemonic, just to remember which nerve is, whether they are sensory, motor, or both. Okay, remember this mnemonic. Some say marry money, some say marry money, but my brother says big brains matter, man. So this is one mnemonic for which you will remember according to the ascending order. First cranial nerve is sensory, second is also sensory, and the third, fourth, this third and fourth are motor. Fifth one is having both motor and sensory activity, right? So try to remember the names of these cranial nerves in this manner. So these are two uh, mnemonics you have to remember. With this mnemonic, you will understand, you will remember all the 12 nerves, and with this mnemonic, you will remember whether which nerve is having motor activity or sensory activity or having both the activity. Okay, so these two mnemonics will help you to remember the different types of nerves. Okay, now let's proceed to learn about each and every nerve, its anatomy, its physiology, and different morphological features and its dysfunctions. So our first cranial nerve is olfactory nerve. Okay, the first cranial nerve, this is the first cranial nerve. Let me tell you some important points about this first cranial nerve. Always remember, see, I told this first cranial nerve is a, first thing is it is a sensory nerve. Okay, sensory, the meaning of sensory nerve is nothing but starting from it is starting from organ, right? It is starting from organ. So from which organ is it starting? It is starting from nose. Very important. Olfaction means smell. Olfactory means smell receiving nerve. Simple. Olfactory means it is it is the nerve which is receiving, it is receiving smell. Simple. So this olfactory nerve is mainly innervated into the nose. Actually, see, if we see the olfactory nerve, as it is a sensory nerve, it is coming from nose. Now let me tell you, see, we have, this is buccal cavity and this is nasal cavity. This is, here we have palate, right? See, in nasal cavity we have, in nasal cavity what we have olfactory. Here we have olfactory nerves. Actually, from here it is starting. In nasal cavity we have epithelial tissue. This is all epithelial cells. In the epithelial cells we have so many branches of olfactory nerves. All these olfactory nerves which is originating in the epithelial tissue in the nasal cavity. From here what they do, they will directly enter into olfactory bulb. There is a group of group of nerve cells which is a ganglia, which is called olfactory bulb. Olfactory bulb. Let me tell you, it is very easy. Initially, actually, this olfactory nerve is starting from the olfactory epithelium of nasal cavity, and from here it is entering into olfactory bulb. It is associating into olfactory bulb, and this olfactory bulb is again entering into olfactory tract, and finally it is entering into brain. Which part of the brain, it is entering into olfactory cortex of the brain. Actually, it is present in the temporal region of the brain. Okay, and see here one important point you have to remember. There is one plate which is present between olfactory bulb and olfactory epithelium, or olfactory nerve branches and olfactory bulb. In between these two we have a bone, or we have one plate. The name of the plate is cribriform plate. Cribriform plate. This plate is the part of ethmoid bone. In previous classes we discussed about ethmoid, sinus ethmoid bones, right? So ethmoid bone is present between the nerves, olfactory nerves and olfactory bulb. I have displayed some images here. I think it will be easy for you to understand. See, this is the nasal cavity. From here we inhale. Okay, this is nasal cavity. When patient inhales smell, or when patient inhales something into the nose, into the nasal cavity, this is nasal cavity. And on the top of the nasal cavity we have epithelial tissue. This blue color one is epithelial tissue, which is containing different forms of receptors, olfactory receptors. We call them as olfactory receptors. Here we have olfactory receptors. These olfactory receptors will receive the smell, and from there what happens, from there all olfactory nerves will receive the smell, and what they do, they will take this information to the olfactory bulb. This is olfactory bulb, and in between this epithelial tissue and olfactory bulb there is this bone which is called cribriform plate. Actually it is a ethmoid bone. Okay, and from this olfactory bulb it is traveling to the brain directly. It is entering into brain. Olfactory bulb, here we have olfactory tract, and from olfactory tract directly it reaches into the temporal part of bone. Actually it is olfactory cortex. Here it enters into olfactory, here olfactory tract, and it is entering into olfactory cortex. Okay, actually we have two. Here this side one temporal bone, temporal part of the brain we have, and here temporal part of the bone. Finally it enters into the temporal part of the bone in the olfactory cortex. Simple, it is very easy. I think you understood. First cranial nerve is called olfactory nerve. Okay, and this olfactory nerve is receiving the special sense of smell through olfactory receptors, enters into olfactory bulb, and from there enters into olfactory tract, and from olfactory tract it enters into olfactory cortex of the brain in the temporal lobe of the brain. It is very easy. See, actually sometimes what will happen, due to some infections, or due to some what we can say, due to trauma, okay, due to some meningitis, we have certain causes: meningitis, smoking, cocaine use. Okay, and sometimes if brain has some lesions, okay, or if sometimes ethmoid bone is fractured. Yeah, just now I told ethmoid bone. If ethmoid bone is fractured, what will happen? The through this ethmoid bone only all the nerves are entering into the olfactory bulb. So here dysfunction can be seen due to rupture or due to fracture in the ethmoid bone. So in that cases what will happen, due to the damage in the nerve, patients will develop anosmia. Anosmia is the condition where people will have loss of smell. They will lose the smelling sensation. That is called anosmia, and this anosmia is caused due to head injuries, due to infection, especially in viral infection. Okay, rhinitis, if anybody has allergic rhinitis or rhinitis, or if anybody has head injuries, okay, or if anybody has ethmoid bone fracture due to cribriform plate damage, in that cases what will happen? Patient will develop anosmia. It is very easy. I think you understood about olfactory nerve. Okay, here you can just understand, when we inhale some air through the nose in the nasal cavity, it enters into the olfactory nerves. Here all these are olfactory nerves. Olfactory nerves will contain different receptors. Okay, from here it is entering into olfactory bulb through cribriform plate. This is ethmoid bone, this one is ethmoid bone, cribriform plate we call it. And from there it is entering into olfactory bulb, from olfactory bulb it is entering into olfactory tract, and from there it is entering into olfactory cortex of bone, both the sides. Okay, so I think this point is clear. Okay, so I think you understood about first cranial nerve, olfactory, and now we will discuss about second cranial nerve, which is optic nerve. Optic means opticals. I think you might have heard about opticals. Optics means, always remember, it is related to eyes. Okay, even this is also a sensory nerve. Optic nerve is also sensory nerve. Actually, it is, see, sensory nerves are, they are originating from, or they are starting from organs, right? From sense organs especially. So in the eyes, if you see, in the eyes we have, in the eyes what we have retina. From the retina all these branches of optic nerve, what they do, they will form a special optic nerve, and what they do, they will come out of the eyes. They will receive all the information, the light information, whatever light it receives, it will take the information, and all these branches of optic nerve will come out. Okay, they come out, and they will enter this information to the directly to the brain. Actually, see here, let me tell you, it actually, we have two eyes, right? Two eyes will join the optic nerve, and it will form a x shaped cross, that is called chasm. Okay, see, you can see here, we have left eye and right eye. Both these eyes are receiving information, and the received information from the optic nerve, what the left part of eye and the right part of eye both are joining together, and it is forming a x-shaped crisscross, that is called optic chasm. Okay, this optic chasm, again, what it is, from here, the left part of eye is taking information to the right part of the brain, and right part of the eye is taking information to the left part of brain. So from the optic chasm, the information is traveled to the pretectal nucleus of the brain, and some part of information is also taken to superior colliculus. And here, this protectal nucleus and superior colliculus, all these things, what they do, they will process the information, and what they do, they help to recognize the different type of radiation or different color. And what they do, they also sense, and sometimes all these different parts of the brain will sense the information, and they also help, they do, they causes eye reflexes when we are sleeping, eye reflexes. Sometimes what happens, this information, actually, from here the information is taken to the lateral geniculate nucleus of the thalamus, this part, and again from there it will be taken to the visual cortex. So all these different parts of brain are having different actions. Okay, so the information which is taken from the eyes, they are taken directly to the different parts of the brain, like visual cortex, they are taken to the lateral geniculate nucleus of the thalamus, it is taken to the thalamus, to the pretectal nucleus, and also to the superior colliculus. So all these places of the brain will have different actions. Some brain tissues will help in eye reflexes, some of them will help to sleep wake cycle. Okay, suddenly we will sleep at night, we will have sleep, that is also controlled by our brain only. So sleep, and we will wake at certain time in the evening, in the morning. Okay, sleep and wake, this cycle is maintained by these tissues only of our brain. Okay, so these are about optic nerves. And if anybody has a disorder in the optic nerve, patient will have, there is a condition called glaucoma. Actually, glaucoma is the condition where the intraocular pressure will increase, we call it IOP. due to elevated or increased intraocular pressure, it will cause pain in the optic nerve, or it will damage the optic nerve. With that, it may cause different dysfunction. Okay, so in glaucoma, it is very important for you to understand. And yeah, these are different things you have to remember about optic nerve. Actually, optic nerve, it is not considered as peripheral nerve. It is directly related to brain. From the eyes, it is directly entering into brain. Okay, it is a single nerve, so it is a part. It is a part of brain only. It is not a peripheral nerve. Okay, but we are studying it as a cranial nerve. Okay, anyways, so we understood about first cranial nerve, which is olfactory, second cranial nerve, which is optic. Now let us try to learn about third, fourth, and sixth cranial nerve. These three nerves are always studied together. Why they are studied together? Because all these three nerves are directly innervating to the eyes, especially to the muscles of eyes. Muscles of eyes. That's why they are studied together. So the first oculomotor nerve is innervating into. Actually, it has two branches. Oculomotor nerve is having two branches, first and second branch. First branch is superior branch, which is innervating to the superior muscles of the eye, and the second one is inferior branch. Both of these nerves are innervating into the muscles of eye, and they are helpful for eye movements. They are helpful for eye movements. And one thing you have to remember, the third cranial nerve, the third cranial oculomotor nerve, it is coming from ventral midbrain. Third cranial nerve is coming, or it is originating from ventral midbrain. Okay, and fourth cranial nerve, which is a trochlear nerve, fourth cranial nerve is arising from dorsal midbrain. Trochlear nerve is originating from dorsal, I'm sorry, dorsal midbrain. And what this trochlear nerve is doing, trochlear nerve is innervating. It is innervating into the upper part of the muscles. Upper part of the muscles is superior oblique muscle. The upper part of the muscle is called superior oblique muscle. And what it is doing, it is helping in opening, especially opening of eyelids and closing of eyelids. Contraction and relaxation of this superior oblique muscle will help for the opening or closing of eyes. Okay, and also it is helpful for movement of eyes. Okay, and now the sixth cranial nerve, which is obducens nerve. It is originating from, the sixth one is originating from pons of brain. And what it does, it is mainly innervating into the middle part of the muscle, which is called lateral rectus muscle. Okay, and this innervation or this obducens muscle, what it does, it abducts the eye, or it pulls back the eye. Indirectly, it is also helping for movement of eye. All these three nerves, oculomotor nerve, trochlear nerve, obducens nerve. Oculomotor nerve is again dividing into two branches, superior and inferior. They are innervating into the superior part of the muscles and inferior part of the muscles. And fourth cranial nerve is trochlear nerve. It is innervating into the superior part of the muscles of the eye, which is superior oblique muscle. Even it is also helping for opening and closing movement of the eye. And the third one, the obducens sixth cranial nerve, is entering into the lateral rectus muscle. Okay, so it is causing it is abducting the movement of the eye. Okay, so these three nerves are important in eye movement. You have to remember this. They are mainly important in movement of eyes. Okay, now let's talk about fifth cranial nerve. Very, very important nerve. Fifth cranial nerve is called trigeminal nerve. There is one important condition called trigeminal neuralgia. Neuralgia means nerve pain. And if trigeminal nerve pain occurs, it will cause headache. Why? Because this trigeminal nerve is innervating into the total part of head. हेड के जो भी regions है, हर एक region में trigeminal branches are innervating. That's why it will cause headache mainly. Okay, let's discuss in detail. Actually, the trigeminal nerve, it is originating from the pons of brain. Brain के जो pons area है, from there it is originating, and it is forming a ganglion which is called which is called trigeminal ganglia. Trigeminal ganglia, and from this trigeminal ganglia, it is dividing into three branches. First one is V1, second one is V2, third one is V3. V1 is innervating into the upper part of the skull, I mean upper part of the face. Okay, and V1, especially V1 is innervated. V1 is innervated into the eyes. It is innervated into the eyes, forehead. It is innervated into the nose and scalp. So these are the different organs where V1 is innervated. V1 is innervated into these organs. The first branch, the green one, and the second middle branch, blue part of middle branch is maxillary branch, which is also called as V2. This maxillary branch is entering into maxilla. It is innervating into maxilla. It is innervating into palate, nasal cavity, very important, nasal cavity, and cheek of the skin or cheek skin. Okay, so V2 is innervating into maxilla, palate, nasal cavity, and cheek. And the third one, V3, very, very important. Always remember V3. V3 is the largest branch of trigeminal nerve. Trigeminal nerve के third branch, V3 is largest one. It is largest. And what it does, actually V1 and V2, which is originating from the trigeminal ganglia, it is directly innervating into the upper part of the skull. Okay, but the third part, the V3, mandibular V3, is coming out of the skull. It is coming out of the skull. It is coming out. It is coming out of the skull through a hole. Always remember, see, there are certain nerves, cranial nerves. Cranial nerves, what they do? They will come out of the cranium. मान लो this is a cranium. They will come out of the cranium through small holes. Through small holes. These holes are called foramina. Foramina. Okay. Through small holes, these nerves are coming out. So through certain foramina. So here you see the third V3 branch is coming out of the cranium through a small hole which is called foramen ovale. Foramen ovale. It is coming out. This V3 is coming out through foramen ovale. Foramen ovale. Which part of the trigeminal nerve is coming out of the cranium means that is V3, and it is coming out through cranium through foramen ovale. And this V3 is innervating into which part of the tissue? It is innervating into lower jaw. It is innervating into lower jaw, lower lip, muscles of lower lip, which helps in mastication, which helps in chewing of food. Okay, it is innervated into chin, and it is innervated into temporal scalp. Actually, it is in total parts of the lower lip. Okay, total mandibular area, it is innervated. Okay, so this is the third part or V3 of the trigeminal nerve. These are important points you have to remember. I think you understood about this trigeminal ganglia, trigeminal nerve. Okay, trigeminal nerve is divided into three more branches: ophthalmic, which is innervating into upper part of the face, and second one is maxillary, which is innervated to the upper jaw, and mandibular V3, which is innervated to the lower jaw. And here this one is the bigger one, and it is exiting or it is coming out of the skull through foramen ovale. That point you have to remember. These are important points. And if any dysfunction or any damage or anything occurs into trigeminal nerve, it will cause severe headache. Actually, for migraine and headache, it has so many other causes. Not only dysfunction in the trigeminal nerve, it has so many other causes. Actually, these trigeminal nerves will release certain neurotransmitters. Okay, those neurotransmitters, if they are elevated, or if any damage occurs in the blood vessels which are circulating into this trigeminal nerve, so we have so many causes. We will discuss about all those things in migraine. Okay, so now next one, I think we understood the fifth one. Now we'll go with the seventh cranial nerve, which is facial nerve. Again, this is important. Facial nerve is important in showing all expression in the face. Actually, you see here facial nerve, especially first thing, facial nerve is originating from brain of the from the bones of the brain, from the bones of brain, from bones it is originated. Okay, and yeah, it runs through from the bones, it runs through the temporal bone. Okay, and what it does here, it forms one ganglia which is called geniculate ganglia. It forms a geniculate ganglia. You know what is ganglia? Ganglia is nothing but it is the cell bodies group of cell bodies of peripheral nerves. Peripheral nerves के पूरे cell bodies, they will associate at one place and it will form a ganglia. Same cell bodies, if they originate at one place in brain, it is called a nucleus. Actually, see, for better understanding, let me tell you, this is a nerve cell, right? And this is a axon, and here we have dendrites. This cell, actually it is a cell body, right? This is a cell body. Different group of cell bodies of peripheral. See, we have two. One is central nervous system, and we have peripheral nervous system. Peripheral nerves means here all we have nerve fibers, and in central nervous system we have brain. All the cell bodies, all the cell bodies in the brain will form a group together. They will form a group together in the brain, and that will form nucleus. Nucleus is the term which is given for the group of cell bodies which forms in the brain. And here in peripheral nerves, if group of cell bodies in peripheral nerve, if they form together, it will form a ganglia. Okay, you have to remember these two terms. One is nucleus and one is ganglia. Nucleus is nothing but group of cell bodies in brain, and ganglia is nothing but group of cell bodies in peripheral nerves. So here गैंग्लिया इज नथिंग बट पेरिफेरल नर्व्स के अंदर जो भी सेल बॉडीज एक जगह पे आते हैं उसको अपन गैंग्लिया बोलते हैं. जस्ट नाउ ट्राइजेमिनल गैंग्लिया वी हैव सीन. Trigeminal ganglia from the brain, it is coming out and it is forming a group or a bulgy tissue which is called ganglia. So it forms a geniculate ganglia, actually facial nerve which is coming from the bones of brain. It comes out. Okay, it comes out, and what it forms a geniculate ganglia. And from geniculate ganglia, actually it has different branches. Facial nerve has different branches. Facial nerve has different branches. In that, the first branch, which is coming from the geniculate ganglia, geniculate ganglia, the first branch, the name of the first branch is greater petrosal nerve. Greater petrosal nerve. I think you all are following me. The first branch which is coming out from the geniculate ganglia. This is geniculate ganglia. From the geniculate ganglia, the first branch which is coming out, which is called greater petrosal nerve. This greater petrosal nerve will enter. It will innervate into different tissues. It will innervate into lacrimal gland. It will innervate into palate. Okay, palate, and will innervate into pharynx. Okay, this is very important, very important. First part of the petrosal nerve, okay, which is greater petrosal nerve. It is innervating into the lacrimal gland in the eyes. It is innervating into the palate, and it is innervating into pharynx. Okay, in pharynx it is helping to swallow. In palate also it is helping to swallow, and here in lacrimation it is helping to release the lacrimation. Okay, lacrimal glands are present. It will actually, this greater petrosal nerve is a parasympathetic nerve. This is important. And second branch is stapedius nerve. Second branch is stapedius nerve. The stapedius nerve, what it is doing, it is a motor nerve, actually motor part of the nerve. It is a mixed nerve. Facial nerve is a stapedius, is innervating into stapedius tissue. It is innervating into the muscles of middle ear. Actually, stapes we call it. it is innervating into the middle ear muscles, middle ear muscle. Okay, and the third branch which is coming out of the facial nerve from the geniculate ganglia is cordia or chorda tympani. This chorda tympani is innervating into the taste buds of tongue. Okay, this is important, this is sensory. See, the facial nerve which is forming geniculate ganglia, from geniculate ganglia the greater petrosal nerve is arising, which is the first part of the first branch. Second branch is stapedius branch, and third one is chorda tympani. Okay, these three branches are very very important. And you see the remaining branch which is coming, the remaining branch is called, very very important, the fourth branch or remaining branch of facial nerve. It is coming down, it is coming out, which is called, it is coming out, I mean exiting the it is exiting the skull, and where it is innervating into different, from here you see it is innervating into five different regions of the face. It is innervating into the temporal region, number one. This is the, I'm talking about fourth branch is innervated into the temporal region. Second one is zygomatous or zygomatic branch or zygomatic branch. The third one is buccal branch. Fourth one is mandibular branch, and fifth one is cervical branch. So the fourth branch is dividing. Actually, it is again dividing into five different branches. So these five different branches are considered with a five fingers of our body. So what it is doing, the first branch is innervating into the temporal region. Second one is zygomatic region. Third one is buccal region. Fourth one is mandibular, and fifth one is cervical. Means it is going below the neck, in the neck region. Okay, this is very important. And now you see, if anybody has dysfunction in the facial nerve, patient will have a condition called Bell's palsy. Bell's palsy is very very important. This is especially seen in certain infections. There is a condition called Lyme disease. In previous days, पुराने जमाने में Lyme disease करके एक bacterial infection था, which is very dangerous, और shingles करके भी एक disease था. Okay, it is a viral infection. So in that cases, this facial nerve is used to get affected due to this infection, and with that, what happened? Patient will have different facial muscle expressions will be lost. Okay, so यहाँ पे I told these are all five different regions it is innervating, right? So some patients will have loss of taste, some patient will have loss of salivation, some patient will have loss of ability to eyes. Okay, all these uh, symptoms patient used to have. Okay, and this facial nerve is also damaged due to trauma or facial injuries, or sometimes due to stroke. Okay, brain stroke is very important. Stroke is very very important uh, disease in which the cranial nerves are damaged. Okay, so now let's go back to our next cranial nerve, and next one is eighth cranial nerve, which is called vestibulocochlear nerve. We'll go fast from now. See, this vestibulocochlear nerve is very easy. It is again originating from the bones of brain ke bones se it is originating. And see, here we have some important part. It is coming out of the cranium. Okay, and what it does, after coming out of the cranium, this vestibulocochlear nerve will divide into two main branches. It will divide into two main branches. The first branch of the vestibulocochlear nerve is called vestibular nerve, and the second branch is called cochlear nerve. Cochlear nerve will innervate into cochlea, and vestibular nerve will innervate into vestibule. There are two main tissues. This is called middle ear. Actually, it is called middle ear. Middle in middle ear we have two main regions, one is vestibule and one is cochlear. These both the tissues are very important in sensing the sound waves which is coming from the external ear. Okay, and what it does, it will receive the information and it will travel to the brain, into the bones. Actually vestibulocochlear nerve is a sensory nerve. Okay, see, if anybody has dysfunction in this vestibular branch or cochlear branch, what will happen? Patient will have dysfunction in listening, patient will have deafness. Okay, so there is I would like to tell you one important clinical point. See, there are certain drugs which will damage this vestibular part of the ear and cochlear part of the ear, which are very sensitive. Actually these tissues are very sensitive. There is a drug called aminoglycoside antibiotics we call it, amikacin, kanamycin, gentamicin. All those drugs are aminoglycosides are having highly ototoxic activity. They will damage the vestibular and cochlear nerves. And along with this drug, there is another drug called furosemide. This is a diuretic. So diuretic is also, this furosemide is also having same adverse effect. So if these two drugs are given together, aminoglycoside and furosemide are given together, they may cause severe lethal toxicity to the vestibular or cochlear tissue, and it may cause deafness. Okay, so this is important point you have to remember. Vestibulocochlear nerve, eighth one is done. And see, some other clinical points I would like to add here. There is a disease called vertigo. There are some diseases called tinnitus. Vertigo is, patient will have chakkar खा के गिर जाते रहता patient. Patient will have fall. We call it blackouts. So that is due to this this nerve disorder. And tinnitus is another condition. Sometimes patient will have ringing sound in the ear. That is due to the dysfunction in this nerve only. And this vertigo and tinnitus are mainly caused due to infection in middle ear. Infection in this middle ear. Actually, middle ear infection is simply called as otitis media. Okay, otitis media. That is mainly caused due to bacterial infection. Okay, so if anybody has otitis media, bacterial infection, patient will develop vertigo or tinnitus or different other clinical presentations. Like finally, it may also cause deafness. Okay, these are important points about vestibulocochlear nerve. Okay, vestibulocochlear nerve, I think you understood. Now let's see the ninth cranial nerve, which is called glossopharyngeal nerve. There are some important points you have to remember about this glossopharyngeal nerve. This is important in physiology. It is very important. See, glossopharyngeal nerve is arising from medulla of brain. It is arising from medulla of the brain, and what it does, it is exiting. It is coming out of the cranium through jugular foramen. It is originating from the medulla of brain and it is coming out of the cranium through foramen. I told, from the cranial nerves, from the small holes, it is coming out. So it is coming out through this foramen, which is called jugular foramen. From jugular foramen it is coming out, and it is innervating into different tissues. You have to remember this important point. It is innervating into pharynx. It is innervating, there are certain branches. It is innervating into the pharynx, which is helping for swallowing of food, and it is innervating into parotid gland. The parotid gland is a part of salivary gland, and here, due to the stimulation of this parotid gland, it will release saliva. So here it is parasympathetic innervation, and along with this, it is innervating into the carotid bodies. This is important. Carotid body. See, carotid body is the part of carotid artery. Okay, carotid arteries are sending blood perfusion to the brain from the systemic artery. Just imagine this is heart. From the systemic artery, carotid arteries are coming, and it is innervating into the brain, right, in the upper part of the skull. So in carotid artery we have carotid bodies. In carotid bodies, this glossopharyngeal nerve is innervated. In carotid body, what it does, in carotid bodies we have some receptors which are called, there are two types of receptors. One is chemoreceptor Okay, chemoreceptor, and second one is baroreceptor. Very, very important, baroreceptor. These carotid bodies will have baroreceptors and chemoreceptors. Chemoreceptors will try to regulate, it will try to regulate the blood pH, it will try to regulate the oxygen concentration and carbon dioxide concentration in the blood. Okay, and baroreceptors will try to sense the blood pressure. If anybody has low blood pressure, immediately the carotid bodies will send information to the brain, and from there it will increase the release of noradrenaline, or it will cause release of renin from the kidneys. So baroreceptors are very important, and chemoreceptors are also very important. So in carotid arteries, these chemoreceptors and baroreceptors are innervated, and these sensing chemoreceptors will understand the concentration of blood pH, oxygen and carbon dioxide concentration. This is important. Okay, so this is about glossopharyngeal nerve. And next, okay, glossopharyngeal nerve, just now I told you, it is innervating into the parotid gland, it is innervating into the carotid artery, and it is innervating into the pharynx, and it is also innervating into the lungs. I think I forgot this, tongue. Okay, so these are different innervations of glossopharyngeal nerve. This ninth nerve is done. So there are certain yeah, glossopharyngeal nerve, I think you understood. See, if any dysfunction occurs in the glossopharyngeal nerve, it will cause certain disorders. There is one condition called dysphagia. Dysphagia means difficulty in swallowing, because it is innervating into the pharynx, and sometimes it will cause aptalia. Okay, aptalia, which is reduced secretion of saliva, because it is innervating into the parotid salivary gland. And sometimes it will also cause agusia. Agusia means loss of taste. So it is because it is innervating into the tongue. So if anybody has glossopharyngeal nerve dysfunction, if this nerve is damaged, it will cause dysphagia, where patient will have difficulty in swallowing. It will cause epitelia, where secretions of salivary secretions were decreased, and agusia, patient will have loss of taste sensation. These three are important if glossopharyngeal nerve is damaged. Okay, now I think we have completed 9 cranial nerves. Now 10th cranial nerve is very, very important, vagus nerve. I'll go very fast about this nerve. See, vagus nerve is the only nerve which is coming out of the cranial nerve and crossing neck region. अभी तक जो भी अपन cranial nerves देखे, all the cranial nerves are innervating into the neck region or in the facial region only. But vagus nerve, which is the only nerve, which is the only nerve which is not only innervating into the face, but also it is innervating into other parts of the body till abdomen. From brain it is innervating, and it is entering into till abdomen. Okay, that's why it is the only nerve which is crossing, or which is crossing beyond the neck region. It is crossing beyond the neck region. This is important point you have to remember. Now you see, actually I told this vagus nerve is originating from the brain, and it is coming out of the cranium through jugular foramen. From jugular foramen it is coming out of the cranial nerve. Okay, and see, it is innervating into different tissues. Let me tell you, it is innervating into in this itself, I'll tell, it is innervating into heart, it is innervating into lungs, it is innervating into facial region. Okay, so actually this vagus nerve has I mean, it is a mixed nerve. It has both sensory activity, motor activity, it has parasympathetic activity, sympathetic activity. Okay, so whenever it is innervating into heart, it will regulate heart rate. Okay, whenever it is innervating into the in heart, means, see, here it is innervating into the carotid sinus and carotid body also. Here carotid sinus and carotid bodies, what they'll have baroreceptors, and they'll have chemoreceptors. Baroreceptors will maintain blood pressure, chemoreceptors will maintain oxygen concentration, carbon dioxide concentration, and blood pH. This point just now I told. Okay, so in aortic bodies, carotid bodies and carotid sinus. All these chemoreceptors and baroreceptors are present, and it will maintain those. And along with that, it will maintain heart rate also. And in lungs, it will maintain bronchoconstriction and bronchodilation. And in larynx and in the tongue region, it will maintain to swallow. Okay, it helps in swallow. And see, one important point: vagus nerve is innervated into epiglottis. And in epiglottis, on the epiglottis, we have taste buds. Taste. This is important. On epiglottis, on epiglottis, we have taste buds, and that sensation is carried by vagus nerve. It is sensory nerve or sensory branch. Okay, so from the epiglottis, it receives this taste sensation, and it is traveling into brain. This point you have to remember. In epiglottis, it is innervated, and the somatic innervations are innervated into the muscles of pharynx and larynx, and which helps in swallowing. And in heart, it helps in heart rate. In lungs, it helps in bronchodilation, and in GI tract, very very important. In GI tract, it helps in peristaltic movement. Peristaltic movement. It helps in peristaltic movement, and along with that, it also helps in release of acid. It helps in release of acid. Actually, in GI tract, we have M3 receptors. It is a parasympathetic nerve. When vagus nerve is activated in the stomach, it will release acid. Very, very important point. Okay. So vagus nerve. So all these are different innervations. In liver also, it has innervations. Okay. Always remember, vagus nerve in the stomach, it causes acid release, and it causes movement of gastric content, because it is stimulating peristaltic movement. And in the lungs, it is causing bronchodilation and bronchoconstriction. Both, it will cause both the actions. Okay, and it is when it is innervated into the pharynx and larynx, it helps in swallowing. Okay, and in heart, baroreceptors are present, aortic bodies, carotid bodies, and all. It maintains blood pressure and all other uh, chemoreceptor actions. Okay, so this is about vagus nerve. And next is 11th nerve, which is called accessory nerve. It is innervated from the spinal cord. This is important feature of accessory nerve. Actually, it is starting from spinal cord. From the spinal cord, what it does, it will go back into the brain, and from brain again it will come back. It will come back into the trunk. About accessory nerve, I would like to tell you some important features. See, one thing you have to remember: it is originating from spinal cord, right? Spinal cord. From the spinal cord, it enters into cranium. From spinal cord, it enters into cranium, or it enters into skull. It enters into brain. It enters into brain through foramen magnum. Through foramen magnum. And again from brain, it comes back. It comes out through jugular foramen. Jugular foramen. Same like vagus nerve, which is coming out through jugular foramen. It is also again, after reaching into the brain, from brain it will come back into the trunk, into the neck region through jugular foramen. And two main muscles: one is trapezius muscle, and the second one is, we have another muscle, which is sternocleidomastoid muscle. These are two muscles. Accessory nerve is innervating into the muscles of neck region. One is trapezius muscle. It is innervating into trapezius muscle, and second branch is innervating into sternocleidomastoid muscle. Sternocleidomastoid muscle. This one. Okay, and with this, it helps in the movement of head. हेड मूवमेंट के लिए अपने को एक्सेसरी नर्व इज इंपॉर्टेंट, बिकॉज इट इज इनर्वेटिंग इनटू द मसल्स ऑफ neck region. Okay, one important point: it is originating from the spinal cord, entering into brain, and from brain again it is coming back, and it is innervating into the muscles: trapezius muscle and sternocleidomastoid muscle. Okay, sternocleidomastoid muscle, and with that, it helps in movement of neck region. And the last cranial nerve, which is 12th cranial nerve, is hypoglossal nerve. Hypoglossal nerve, it is originating in medulla of brain. In medulla of brain it is originating. Okay, and it comes out of the brain. It comes out of the skull. through a foramen which is called hypoglossal foramen. Hypoglossal foramen. And what it does, it supplies to the muscles of tongue, and it helps in swallowing, and it helps in speech. Hypoglossal nerve is innervated into the tongue, and it helps in swallowing, and it helps in speech. Okay, if anybody has hypoglossal nerve injury, it will cause dysarthria. Okay, dysarthria is a condition in a patient who will have disorder in speech, difficulty in speech, or slurred speech, we call it slurred speech. Sometimes it will also cause difficulty in speaking, and difficulty in chewing, and difficulty in swallowing also. Okay, and sometimes it will cause dysphagia. In difficulty in swallowing, called it is called dysphagia. Okay, so these are different cranial nerves. Okay, let me summarize. See, the 12th cranial nerve is hypoglossal nerve, which is innervating mainly to the tongue region of our body. I'll stop here. If you have any doubt related to these cranial nerves, please watch it again. Pause the video and watch it again. I have collected information from different sources, standard sources, and I try to explain everything about cranial nerves. I hope you all understood about cranial nerves, their physiology, their innervations, their functions. And always remember these mnemonic to understand whether they are motor nerves, sensory nerves, or they are having both the actions. And remember this another mnemonic through which it is easy for you to remember different names of the cranial nerves. Okay, that's it for today. Thank you all for joining. If you learned something from our video, please don't forget to like, subscribe, and share this video to your friends. Thank you all.